The last conceptual framework that I'm going to share with you is a psychiatric assessment decision tree. Doctors love decision trees, okay? It's just the constantly decision trees. So this is a really nice one that's very straightforward that somebody said, so another question here was, how do I convey that what the student might be having in the school might be mental health issues rather than autism? This is something that can help, or if you're working with medical professionals, a decision tree like this can really help. So, the first part of the decision tree that is suggested, this is by Bradley and Summers and others, is anybody saying there's a problem? Okay, that's all this means, right? If there's anybody saying that, if no, then why are you asking these questions? Okay, that somebody is saying there's an issue here, there's a concern, okay? The first thing you should ask yourself is, are there undertreated or undiagnosed medical issues at play? The concern could be behavioral aggression, it could be reports of anxiety, crying, right? The person can be verbal, nonverbal. What's the person's level of medical what's their medical situation like? There are kind of the big four, I'd say, medical things that you need to be wary of. So what are the big four biological medical things that might be mistaken for a psychiatric issue in autism? What do you think?
Gut issues.
So raise your, what's that? So gut issues, so gastrointestinal issues, okay? Well, I wouldn't say gut per se. I'm not necessarily the microbiome kind of situation, but acid reflux, practically speaking, bloated kind of stomach, constipation, acid reflux, right? These are often very common for whatever reason in people with autism, and they're often undertreated. Okay? I'm not talking about they need a special diet and then their issue's going to go. I mean, when was the last time they went to the bathroom? Right? Maybe when they eat tomatoes, like I can't have tomatoes. I get acid reflux. I get indigestion, and that hurts, right? So I don't eat tomatoes, right? But what are those? Those are two big undertreated ones, especially if I can't point to my stomach and tell you, ouch, this hurts. Let alone say, you know what, I haven't gone to the bathroom in 4 days. Or 5 days. And there was a case at the psychiatric unit that I used to work at where the young man was on antipsychotics, anxiolytics, kind of anti-anxiety medications, still very aggressive in the community. There was community breakdown at his residence as a result. And they realized that he was constipated and that the side effects of some of the medication was leading to constipation as well. So it was just kind of worse off. And they were trying to just treat it. Then they tried to use laxatives, but that only works so far, and then that also has terrible side. If anybody's been constipated and tried to take, it's horrible, right? It's not comfortable, but he couldn't communicate even pointing non-verbally to his belly. He actually needed somebody to put their hands on him and to do a careful medical exam. But because of his size and his behaviors, right, and what people were attributing in the environment those behaviors were a result of, he was being neglected in that way. And it required this kind of safe. So I'm not advocating for people to be off medication, right? This is an environment where people can go on a drug holiday and people do a careful, secure, safe, full medical exam, right? So it's a very specialized setting. But it was a case where after they rectified the constipation, then they could easily bring in behavior therapy to differentially reinforce communicative behaviors, and his aggressions went down quite quickly. Okay? So GI issues, huge undertreated issue that could be mistaken for or what would appear like mental health issues in this population. What's another one? Appendicitis. Okay, so there are a whole host of undertreated, potentially acute issues. So I'm really asking more about chronic issues rather than acute ones. Of course, any type of acute issue that's not recognized, first of all, it's just physically dangerous, right? But secondly, could be mistaken in terms of behavioral issues for sure. But what are some of the other chronic issues? Blood sugar could be an issue. That's not one of the main four kind of issues, but sure, of course, if you have if you don't eat at the right amount, if you don't have proper diet or nutrition, right, or you're prone to low blood sugar.
Vision and hearing. So
sensory issues. That's right. Vision and hearing issues. Okay, that's one of the top big ones is underaware. You're not aware that this person actually is walking around with blurred vision constantly and can't see well, right? Or can't hear and is muffled. And it might not even be a sensory impairment. It might be so much wax buildup in their ears that it's muffled from a decade of wax buildup, right? So there are many different ways that this can happen, okay? But careful on sensory kind of processing issues there in that way, right? Visual and hearing, okay? The other one is seizure disorder, right? Not necessarily epilepsy, but the potential for a seizure disorder. When you're seeing a chronic manifestation of often fixed, odd behaviors that we're not able to link to contingencies in the environment, right? This is me, my behavior hat on, right? When you can't identify a function of the behavior at all, after you've done a careful functional assessment, even if it's not an experimental functional assessment, even through kind of structured questionnaires, you might ask yourself, is it possible that there's some untreated seizure disorder going on here, right? So GI issues, sensory issues, seizure issues are kind of, and the last one, dental issues, that's right. Okay? Underdiagnosed kind of, now there's other ones too. There's probably other ones, so the point here is bigger than just those 4. But these are my advice to you is really to ask, when was the last time they went to the dentist? Right? So in the decision making, they always say, can you rule out, are there any potential medical issues or biological issues that are undertreated, right, or not aware of? If you say no to that, okay, if yes, then, you see, it's very straightforward. Then treat that, right, address that, and then see if the problems subside. Now, often, it's not that easy, because in kids who develop fixed response patterns, fixed behavioral patterns that have problems shifting, that might be the precipitant, right? That might be the stressor that brings about the problems to begin with, but it's no longer the maintaining factors. It's no longer the perpetuating piece, right? So now it's taken on a life of its own. Still want to address it, but we might still need to go forward. So you look to see whether it's changed. And then you ask yourself, okay, we've ruled that out. Is there a discrepancy, a dissonance between the expectations that are placed on this person and the supports for this person? And it can go both ways. You could have issues where the person has too many expectations set upon them or that they're setting for themselves relative to the amount of support that they have. Or you could have the situation where the person has a lot of support but not sufficient degree of expectations. That's an important one that I think we don't think of as much. We're often very keenly aware, and we can realize it's automatic to assume, right? If you have a certain capacity and ability, and people set the bar so much higher than that, and they don't bridge that gap, they don't help you, of course you're going to feel anxious about something, right? You're being asked to do something that's not within your wheelhouse. It's not fair. That's not a mental health issue, disorder. It's not a psychiatric disorder. Right? That's a logical reaction, that's a rational reaction to the fact that you're in a situation that you shouldn't be in with the level of supports being provided. If that's the case, then we adjust those supports, or we adjust the expectations, depending. There is this other group, and Judy Reaven talks about this with Facing Your Fears, when it's an anxiety program. Jeffrey Wood has also talked about it, where many youth with autism, who often they're talking about youth who don't have an intellectual disability, are in situations for very good reasons where they're not faced with demands, where they're not faced with expectations placed upon them. So then even the littlest expectations bring about a sense of non-confidence. Is that the right word? Non-confidence? Unconfidence? Anyways, let's move on. The point is that they feel anxious because they don't feel like they can handle the situation. Or it's been happening for so long that they don't actually have the skill set, the behavioral repertoire to handle that situation, but chronologically they should, and from their maturity perspective, they feel like they want to, but those demands have never been put on them. So then there's many teens I see who are graduating high school, and the school has done an excellent job of creating a system, a wraparound supports where there's very little anxiety-provoking situations for that person. Their demands are really adapted, right? The school demands are adapted. The schedule is adapted for them. And because of that, there feels like a very good fit between this student's needs and the environment, right? And there is. It's working quite well for everybody involved. Everybody's agreeing that this is it. He's learning. He's moving forwards at his own pace, right? According to in ways that are valuable to him and his family. It looks great. But then they graduate. Right? And they get put into a college environment where the expectation is, well, I've been getting A's all along, right? But these are adjusted A's. These are A's according to this child's IEP, right? These are accommodations that have occurred and adaptations to the grading schemes and to what's expected of them and how they can show what they've learned, et cetera. And then they're put into another environment where that's not the case. They always felt like they were an A student. They always got A's, right? And they were able to tailor the schedules and people understood them and wrapped around. And then they get put into an environment where they're actually, compared to their peers and the way that they're being taught and tested, C student even. Let's say, I'm not saying they're going to fail, but they struggle differently. Or even if they work hard and they succeed, they get different grades. And then all of a sudden, now we see anxiety coming above and depression and anger, right? Because there's this discrepancy between the expectations they had for themselves and the supports. So we want to try to align this as much as we can and keep it going forward where the person develops self-determination and self-worth. So adjust your supports and your expectations. Let's say you do that. That's a big conceptual piece, so I'll get off the soapbox. Let's say you actually said, you know what, this person needs a part-time EA to help keep them on task in the school, right, and to help coach them. And you get that, you bring them in, and the person's working, and it's working really well, so the person feels a little bit more comfortable in that situation, but they're still highly anxious as a result, even if you've tried to adjust that. Well, then they suggest, ask yourself, what kind of emotional problems, what kind of psychological vulnerabilities does this person have? Maybe they, for their own internal reasons, are very emotionally labile. Maybe they are quick to react. Maybe it's like they've always been like walking on eggshells. You ever have kids like that who are just very sensitive kids? In fact, it's a myth that kids with autism don't have empathy, right? Many kids with autism are highly empathic in the sense that they feel others' emotional states. Where they struggle with empathy is in processing the information effectively in an adaptive way. But they just flooded with they feel a lot from themselves and others, right? So there might be kids who might be struggling with emotional difficulties, right? And they might always struggle with emotional difficulties. Doesn't mean they don't deserve support or help. It's not, the answer isn't if they have that, then they don't get mental health supports. It's just that in terms of understanding, is there an additional, what we think of as a psychiatric condition going on? If we can make sense of this based on the person's situation and who they are and their context, then they're struggling with emotional issues that we have an onus of addressing. But let's not call it, we don't need to go and diagnose them with something else. And this fits really well with me because I'll treat a child with CBT and that child's family, I'll aim to support that whole family, regardless of whether they meet all criteria for major depressive disorder or they must meet clearly social anxiety disorder separate from autism. If I've identified that there are emotional issues at play here and I can have a conceptualization that fits and says these strategies might be helpful, then I'm going to try them, right? Make sense? After that, they say, okay, and where this is really useful from a psychiatry perspective is that if you're talking about them and there's questions of medication and should we medicate, that's what they're really talking about here, right? They're saying, well, if you're trying CBT, if you're trying to build skill sets, if you're building adaptive skill behaviors and addressing the environments, if you're doing all of that and it's still not working, maybe we should consider also psychotropic medication. Right? This is kind of from a psychiatrist, dual diagnosis psychiatrist saying there's a role for medication, but it's not the first line treatment. It should actually be after you try all of these other things first, right? And in concert with these other things. So this might be helpful in communicating, what's going on or getting people to see that there might be things in addition to autism going on, because you can say, listen, I see this nice decision tree, this pretty one that we printed out, that's really straightforward. So I've checked about medications and there's no medication issues here. And you know what, Billy's actually got really good supports at play right now, so I don't think that's what's going on. And he's always been anxious, but this is more than his regular anxiety, right? This is something different now for Billy. Right? Even that, as I've just said it, if you're trying to convey this to somebody who's not a clinician, right? And you have it on a piece of, for some reason, if you print this out, it looks more like you're more legitimate, right? So print it out and then you can actually say, look, I did these things and look, there's a reference, right? And then, and that can be a really useful tool to just quickly convey why you feel like there's some mental health issue going on here.